From this type of studies, other complications emerged. One of the most important is related to the differences in the response to the vaccine along with the age of the patient. In infants, the titer of the antibodies after the first dose is barely detectable and it starts to increase above a protective threshold only after the second and the third dose. Over time, the titer slowly decreases until it reaches the value of non-immunized children, but the presence of memory B cells is proved by the rapid and high response to the vaccine after 3 to 5 years, obtaining an antibody titer that can reach 3 to times the original response. In contrast, the unconjugated vaccine is not able to elicit anything. In toddlers, the response follows the trend of infants, inducing a response after the second dose and an even higher response after 3 or 5 years. The main differences are with adolescents, where the protective threshold is achieved after the first immunization and the titer remains higher than the control group. Also in this case, the response is caused by memory B cells, since the injection of the vaccine after 3 years induces a greater response. In this group of patients, we can see a similar trend. We can see a similar trend also for polysaccharide vaccines, but without the formation of memory cells. Coupling the vaccination with adjuvants like MF59 or AS04, able to bind TLR in dendritic cells, improve the response in infants, animal models, and the titer increase if more doses are used. But for adults and adolescents, there is no difference between the single dose or multi-dose response, also in the presence or absence of adjuvants. An interpretation of the results obtained from the different groups with different ages is that in adolescents, adults, and elderly, there is a pre-existing immunization that generates B cells that produce antibodies with the specificity for the vaccine polysaccharide or for another polysaccharide, but with cross-reactivity for the one used in the vaccine. A possible reason is that polysaccharides are made with common block, so an immune response can be generated by the gut microbiota or the food, and this causes in adolescents a T-independent response of the low-affinity memory B cells. This process explains the same response to the different vaccines after the first injection, even when only a polysaccharide is used as antigen. But in the case of the use of glycoconjugate, eventually the carrier is able to induce the formation of a germinal center and produce memory cells able to guarantee a long-lasting protection. On the opposite, a polysaccharide vaccine is able to induce a forced response but can also lead to the inactivation of already present B cells, reducing long-lasting protection. For this reason, after the first injection of the glycoconjugate, a booster dose will be effective only after at least 9 months.